Now let's look at the indications or uses of Ryles tube. It can be divided into therapeutic use and diagnostic use. In therapeutic use, it can be used to decompress the GI tract, like in condition like paralytic ileus, intestinal obstruction, or acute dilation of stomach. In this condition, the gastric mobility is compromised, so Ryles tube can be used to decompress the GI tract. It can be used to keep the stomach empty or to give local rest by giving already pre-digested foods, like in peritonitis or after and intestinal anastomosis. It can be used to prevent distension of abdomen, especially after incisional hernia. After an esophagus operation like resection of growth or excision of diverticuli, right, resection of growth or excision of diverticuli, or suturing of esophageal tear or correction of TE fistula. It can be also used for feeding and gastric lavage, which are more common uses of Ryles tube. Feeding in unconscious or comatose patient to maintain the nutrition, or in gastric lavage by in alcohol poisoning or non-corrosive poisoning, or in hematemesis. This is prerequisite before facial surgery. It can be also used in other ways like a catheter in suprapubic cystotomy or nephrostomy tube, or as a tourniquet. So let's summarize the uses of therapeutic uses of Ryles tube. It can be used for feeding, say in unconscious or comatose patient. It can be used for lavage in certain type of poisoning like alcohol poisoning or non-corrosive poisoning, or in hematemesis. It is prerequisite before facial surgery, or in esophageal, after an esophageal surgery, after excision of diverticuli or resection of growth, or in after correction of tracheoesophageal fistula, or after suturing the esophageal tear. It can be used to decompress the GI tract or to give rest to the GI tract, or to prevent the distension of the GI tract. Now let's look at the diagnostic use of the Ryles tube. It can be used for gastric function test to aspirate the gastric juice to know its secretory activity and mobility of the stomach, right? Now let's look at the pentagastrin test. Pentagastrin is similar to gastrin hormone, which stimulates the acid secretion. This is a 5-peptide gastrin molecule which stimulates the acid secretion in the stomach. What we'll do, we'll measure the basal acid secretion, and we'll measure the acid secretion after introduction of pentagastrin. The normal basal acid secretion in men is around 1 to 5 milliequivalent per hour, and after stimulation of gastrin or an artificial molecule like pentagastrin, the secretion will be raised to 18 to 28 milliequivalent per hour. Now there are certain abnormalities of basal acid secretion. It may be completely absent in pernicious anemia, in which there are autoantibody against the parietal cell, which result in achlorhydria. It can be low in gastric cancers. It can be high in ulcers, which are the etiology for the ulcers, or it can be very high in Zollinger-Ellison syndrome, which is a gastrinoma, a tumor which secretes the gastrin and result in increased acid secretion, right? Now if you find abnormality in basal acid secretion, you'll do a pentagastrin test to stimulate the acid secretion. If you find very high acid secretion after stimulation, it might be duodenal ulcer, or if you find very high gastric acid secretion after pentagastrin stimulation, it may be Zollinger-Ellison syndrome. It can be used for Bernstein. It was used for Bernstein test. It is obsolete now, which was used to differentiate esophageal pain and pain of cardiac origin. And an acidic substance was introduced in the esophagus, and if the pain is accentuated, that means the pain is of esophageal origin, and if it doesn't accentuate, that means the pain is of cardiac origin. But it is obsolete now. Nowadays the gold standard for diagnosis of GERD is 24-hour pH monitoring. It can be used for Hollander insulin test to confirm the completeness of vagotomy, that means the severance of vagus nerve. What happens, insulin is given to induce the hypoglycemia, and this hypoglycemia stimulates the gastric acidity secretion if the vagus nerve is intact, and if acid secretion is not there, that means there is successful severance of vagus nerve. It can be used to diagnose pyloric obstruction. The patient is asked to drink half pint of barley water with indigo caramine dye, and after 1.5 hours, if you aspirate no color, that means the gastric emptying is normal, right? And after giving a wash, you will give a gastrographin dye and perform an X-ray to determine the pyloric obstruction. It can be used after an abdominal trauma. If the Ryles tube aspirate is blood stained, it indicates an injury to the stomach and an emergency laparotomy is indicated. Okay, it can be used for differentiating bleeding above the pylorus and bleeding below the pylorus. If the aspirate is blood stained right from the gastroesophageal junction or in the stomach or beyond the pylorus, that means the bleeding is somewhere above the pylorus, so that the aspirate will be blood stained everywhere. If the bleeding is below the pylorus, the aspirate will be only blood stained after the Ryles tube has reached the pylorus. It can be used for collection of duodenal contents and typhoid carriers, or to demonstrate tubercle bacilli, especially in pediatric patient. It can be used to diagnose pseudopancreatic cyst. Right, what you'll do a lateral view of the abdomen, the film of the lateral view of the abdomen after the introduction of the Ryles tube. It will show that the tip will be near the anterior abdominal wall due to compression of stomach from behind. Like suppose this is the spine and this is the anterior abdominal wall. You'll find that the Ryles tube tip will be near the anterior abdominal wall due to compression of the stomach from the behind. This is called Bates sign for pseudopancreatic cyst. So this is once again the summary. This can be used for gastric function test to know the basal acid secretion and to know the pentagastrin stimulation acid secretion. To differentiate bleeding above the pylorus and below the pylorus, it can be used for collection of duodenal contents like in typhoid carriers or tubercle bacilli in pediatric. It can be used for pseudopancreatic cyst, and to demonstrate the Bates sign, it can be used after abdominal trauma if emergency, or it can be used after abdominal trauma if it is blood stained and emergency laparotomy is indicated. Now let's see the complication of Ryles tube. It can result in rhinitis, sinusitis or otitis media, or upper respiratory tract infection, esophagitis or esophageal perforation if it is introduced in acute corrosive poisoning. It can result in aspiration pneumonia if by mistake the feed is given when the tube is in the trachea, or it can result in excessive gagging. If the intubation is within the trachea, there'll be cough and gag reflex to the patient. You may ask the patient to say his name, or if he say his name, or to take the deep breaths. If he is unable to say his name, then you may remove the Ryles tube and try to reinsert it again. Now, what are the contraindications of Ryles tube? Absolute contraindication is an acute corrosive poisoning. It may result in esophageal perforation or in severe maxillofacial trauma or in stricture esophagus.